Well, hello everyone. My name is Robyn Cruze, and I am the National Recovery Advocate for Eating Recovery Centre, the author of Making Peace with Your Plate, and most importantly, I am here as somebody who has travelled my own journey of recovery of binge eating disorder and bulimia nervosa. Hello, hello, hello. I am here with Dr. Julie Friedman, who is the Executive Director of the Binge Eating Treatment and Recovery Program at Eating Recovery Centre. And Julie treats night eating syndrome, binge eating disorder, bulimia nervosa, pre- and post-bariatric behavioral care, and obesity medicine. Oh my God, that's such a mouthful.
It is a mouthful.
I am so glad to have you here.
Thank you. I'm so glad to be back. And we're pros now. We're pros at this Facebook Live thing.
We are. This is our second time, everybody.
Exactly. I feel like an expert already, Robyn. This is good.
I know. Well, I still feel a bit awkward, but that's okay. I'll get used to it.
There's always.
Right? So I would love for whoever is on here to put the comments, in your comments, put your name and where you are from. I already see that Karen is from Kentucky. Hi, Karen. Hopefully I'll be able to see some people. Michael, Belinda. Hi. Hi. Angela. Oh, my goodness. Hi, Angela. Hi, Russ. Andy. Oh, hi, Andy. Nice to see you, my friend. And Jennifer. Yeah. Hi, everybody. So listen, I'm going to get down to it. Last week we put a post up on our community about night eating, and I personally know that nights are just such a horrible, horrible time, especially when we're trying to overcome, compulsive overeating, food addiction, binge eating disorder, whatever you like to call it. You are our tribe. But when we did this post, there was literally, you guys, so many of you, there was hundreds of comments about how much we struggled with this binge eating at night. And so we decided to have you on, Dr. Friedman, so that you can kind of help us understand what this is, because I feel like everybody feels like they're alone, and they're not.
Right.
They're not, as you can see from the post, they're not alone. But so
you're right. And I think, Robyn, first we have to sort of differentiate what is binge eating disorder that is particularly active at night, and bulimia nervosa as well, because I know we have a lot of people in our community who actually struggle with binging and purging, and they'll write about that to us. And I think it's important to note that both conditions do tend to get worse at night. And that's for a few reasons. Number one, I think it's access, particularly for binging. A lot of times people are busy during the day. They're public during the day, whether they're at work or taking kids to and from school or whatever it is. Very difficult for them to have access to binging necessarily during the day. Although, of course, when we, have a behavior that we're struggling with, we find ways to do it because that sort of drive to engage in the behavior is so strong. And we know for bulimia nervosa, binging and purging as well, it tends to be more active at night. And again, that's for a few reasons. I think number one, access, but also number two, there's a lot of research that looks at patients with eating disorders and how their nocturnal anxiety and their nocturnal sort of irritability or agitation is pretty high. So they tend to get a little bit more antsy or irritable or agitated at night. And food and particularly behavior use, binging and purging, very, very helpful as a way to regulate that agitation. So I think there's, again, binge eating disorder or bulimia nervosa that's more active at night. But then there's also a distinct eating disorder that's called night eating syndrome. And I will say I present.
So let me just be clear for the audience. So there is a difference between binging at night,
yes,
right? So relieving the anxiety, the boredom, and all of those things. So there's that one thing which is very common, right? Now, is that associated with binge eating disorder and bulimia nervosa? Is that what you're saying?
It's not associated. We know it goes along with. So when you look at diagnostic criteria, binge, you don't sort of meet criteria for binge eating disorder based on the fact that you binge at night. However, we treat this every single day here at Eating Recovery Center, and we see a lot of people whose behaviors are just more active at night. And again, I think that's for a lot of reasons, but with binge eating disorder and bulimia nervosa, we don't tend to think of that as hormonally driven, that it is hormonally your body clock telling you to eat more at night. However, there is a whole different ballgame in terms of a different syndrome that we call night eating syndrome. And I was saying that, I present all over into eating disorder professionals around the country, and I'm always shocked by how few people even know what this is. And it's newer to our diagnostic manual, much like binge eating disorder. But also I find that it's mostly undertreated and underdiagnosed in a clinical population and fairly prevalent. We know that a lot of people struggle with this. So night eating syndrome is different in the sense that night eating syndrome is a little bit of an eating disorder, a mood disorder, and a sleep disorder. So the symptoms are essentially the fact that somebody has a very significantly delayed intake of food. So they might not start eating until late in the day. We call that morning anorexia. And we're really looking for, 4 or more mornings per week. Are you either skipping breakfast or sort of forcing yourself to have breakfast and having it later? So we look at that. And then we look at, conversely, what we call evening hyperphagia. So evening hyperphagia is really this idea that people are eating a majority of their calories after dinner and before bedtime, and or they are waking up in the middle of the night and eating in order to go back to sleep. And I think that is something that we see all of the time, where people are eating to go to bed initially. So they feel as if they need to eat until they fall asleep. Otherwise, they won't fall asleep, and they really struggle with initial insomnia. Right. Or they feel like when they're up in the middle of the night, they need to eat in order to get back to sleep. Night eating syndrome is also associated with that sort of belief that one needs to eat in order to go to sleep or in order to go back to sleep. And night eating syndrome really tends to be associated with, I don't want to use nerdy terms here, but sort of a shift in mood throughout the day. We call it diurnal variability of mood, where somebody wakes up and feel, I know, I want to nerd out on you, but I did. I geeked out a little bit there. But just because it's a very distinct pattern where somebody wakes up and they feel pretty good, and they get out of bed and they go and do their thing. And then as the day goes on, they get more agitated, more depressed, more irritable. And that does tend to be a mood pattern that we see with night eating syndrome. And then lastly, we see a lot of sleep disturbance with night eating syndrome. So difficulty falling asleep, difficulty staying asleep. And I think that's another reason why it might be underdiagnosed, because people don't realize what is normal insomnia and what's pathological. And we really want you falling asleep within about 20 minutes. And if you are up for too much longer than that initially, we would be concerned about that and we would want to intervene. And I think that's important because so many times I ask a patient, do you have trouble sleeping? And they'll say, no, I don't. Okay, well, how long does it take you to fall asleep? And then they'll say to me, oh, it takes me an hour to fall asleep. That's something we want to treat. We can help you with that. Sleep is a behavior like any other behavior, and we can teach you to behave differently with regards to your sleep pattern. We also see with night eating syndrome difficulty staying asleep. So somebody falls asleep fine. They're usually pretty sleep deprived. So they fall asleep as soon as their head hits the pillow, but then they are up in the middle of the night. And again, they're needing to eat in order to go back to sleep. And so those are all patterns that we see with night eating syndrome. I'm sorry, I keep talking.
Oh, no, I love it. There is, and you know what, this is such a complex thing.
Yes,
so I love that you are talking, but I just want to let everybody know, if they've just come on, that my name is Robyn Cruze and I'm interviewing Dr. Julie Friedman, and we're talking about night eating and night eating syndrome. I just want to hear from everybody else a little bit. Belinda says they are fine until I wake up and have to have something more to eat.
Yep.
And so sleeping is a real issue. Like, how do you sleep and get the proper amount of sleep when you are waking up and feel that you have to eat in order to get back to sleep.
Well, and that is part of the problem for Belinda and for everybody who's out there. We see this all the time where somebody will eat. That sort of calms them down just physiologically. It's not even as emotional as, sort of calming them down emotionally or from an anxiety reduction standpoint. They start to kind of relax enough to be able to go back to sleep. But the problem is after you have eaten, you don't get into really deep sleep. And so what happens is people are sleeping maybe 8 hours, but it's not a nice proportion or percentage of our slow wave sleep or our deep sleep. And that's what we see all of the time where people are sleeping, but because they're eating and the sleep is disrupted, they're not really getting good sleep. And so they wake up and they might be cranky or feel really tired.
Doesn't that like perpetuate that cycle? Because I know that when I'm tired, one of my coping skills, or what they used to be one of my coping skills, is to go to food.
Absolutely. Right. And not only to go to food, but to go to specific types of foods. So we know with night eating syndrome, we see a much higher proportion of people eating simple carbohydrates, right? I mean, it makes so much sense. It's quick energy, high starch, high sugar foods. So I think that, yes, our body in some ways is really craving that when we're sleep deprived. And, we know that is part of night eating syndrome. And I think that's what always gets me as a provider treating these patients, is that everybody walks into our offices feeling that this is their fault. And this is a behavior that they've sort of done to themselves. And night eating is very hormonally driven. We know that people with night eating syndrome, their hunger hormones actually go up at night and in the evening, and their sort of satiety or their fullness hormones are actually stronger during the day. So physiologically, they're just not that hungry during the day.
Right.
And they get full very easily during the day. And then that sort of reverses at night, where they start to get hungrier and hungrier and feel less full. And again, that's hormonally driven.
I love that you are saying this, Dr. Friedman, because I hear time and time again on the community that people just think that if they had more willpower, if they weren't as lazy, if they just tried harder, if they just, once, and it's so hard to see that, because it's not their fault.
Absolutely.
I always say that if you had a friend and they had diabetes and they had a flare up, would you say, listen, this is your fault. You can control this yourself. No, they need to have treatment, and they need to, they need to change things.
Absolutely. And particularly with night eating, we know that these patients tend to be more stressed physiologically, where they have sort of more of a stress response. Their hearts beat faster, they breathe faster at rest. I mean, it's a very interesting profile biologically. And so they feel physically and emotionally more stressed than non-night eaters. I think that's the best way to explain it. And so oftentimes I think people have interpreted this as a stress habit versus eating disordered behavior. And that's what we hear over and over again. Well, I just thought that I didn't have any discipline at night. I didn't realize this was an eating disorder. And I think really look at it as an eating disorder and frankly, part mood disorder too. Then we start to think about maybe getting professional help for it. But when we think about this as like a little habit, I have this stress eating habit, people feel that they should be able to conquer their habits on their own. Very, very different. And so I think also we have to really acknowledge that these are eating disordered behaviors, and they do really require specialized eating disorder treatment. And I know we have some of our alumni on here, and they will tell you that it is really hard to interrupt these behaviors on their own, because it's so many levels. It's how you deal with stress, how you deal with boredom, how you deal with just being unhappy in general. It's what kind of routine you have around your eating, the planning for that, the implementing that, what kind of routine you have around sleeping, what's going on in your home, how chaotic is your home. And unfortunately, we see a lot of patients who have pretty chaotic homes, and it's really hard to implement a sleep routine on their own. So I think that that's also part of this, that night eating particularly is one of those behaviors. it hits so many different things. It's how you eat, it's how you sleep, it's how you manage your mood, that we need to attack it at every angle as well, or we're not going to be all that effective in doing anything about it. And that's part of why I think people really need somebody who knows what they're doing in this area and can help them work through all of that.
So for all of you who have just joined, my name is Robyn Cruze, and this is Dr. Julie Friedman, and we're talking about night eating. And whether it's night eating or night eating syndrome, there are many, many people that are struggling with this, feeling like they have to do it on their own. Sheila says, yes, I struggle at night. Belinda and Cindy agree.
Yeah. Yes. And I would just want to say too, Robyn, in terms of all of our community members saying that they struggle at night, let me just normalize that a little bit. It is very, very common, even if you don't have night eating syndrome, you know, you don't meet full diagnostic criteria. Night eating in binge eating disorder is very common. We see this about 25 to 30% of the time in binge eating disorder, and about 50% of the time in bulimia nervosa. So this problem is out there. A lot of people are experiencing it, and I think a lot of people just aren't talking about it.
And I'm glad you're talking about bulimia nervosa as well, because there's a lot of people in our community that binge and purge.
Absolutely.
And
yes. And I think that, again, we know that tends to be more active at night. And it is a cycle. And I'm so glad you brought that up, Robyn, because, you know, if you think about what do you do after a binge the night before, you're typically not waking up in the morning ready to go eat more, you know, and so it is this cycle where somebody has a lot of eating volume at night. You know, they're grazing all night. They're eating little bits very frequently throughout the evening. They're binging at night right before bed, which again is fairly common. You know, we see this all of the time. And then they go to bed, they get pretty disrupted sleep. So they wake up fairly tired, and they might wake up kind of cranky. And then wake up, they don't want to eat breakfast. And of course not. And what most patients have learned is that the day after a binge, I need to be good. And eat it all. You know, I need to be perfect now because I feel so crappy from having binged the night before. So they don't eat in the morning. You know, they don't eat until later in the day. And then basically that hormonal cycle, or that circadian rhythm cycle is what we call it, that body clock cycle, is perpetuated again and again. And that's where so many of our patients really feel like they can't get out of this. Because the behavior feeds itself, where you're not going to feel like eating breakfast the next day. And eating breakfast the next day is going to set you up to night eat the next night.
Right. And then you have the shame too, right? That you ate and you binged, and then, you know, I have to be good, as you said. And so then it's just like this, you know, the shame spiral as well. So it's like a cycle of, you know, Sheila says that she can't go to sleep unless she eats a lot of sugar.
Yes.
You know, it becomes like this. Can you speak to that?
Yes. And I would say Sheila is a very smart woman in the sense that she has figured out something that really works. In that we know, and we talked about this, I know, a little bit last time on our Facebook Live, when you eat, you stop producing stress hormones. We know that. The eating is very effective at reducing physiological and psychological stress in the moment. So she's found something that works. And I think sugar particularly tends to numb people out, where when they're done, they just don't feel anything. And that's pretty reinforcing. I mean, when you think about that, we're taking something really potent and really bad away, because it feels so crappy to be in that shame spiral, as you mentioned, Robyn, or, you know, anxious or agitated. And so when I take it away, I've just increased the frequency of the behavior that I used to take it away. So very, very common. And what I would say is that we're not saying don't eat at night, because I think that's very important. And I'm not saying don't eat sugar at night. But what I would say is that we need to probably space out her eating a bit throughout the day, make sure that it's consistent. I mean, we want, and we do this even in programming here, we want people eating within about an hour and a half of first waking up. which for a lot of patients who are used to eating at night feels weird, feels really uncomfortable for them. They don't want to eat when they first wake up, but we've got to reset those body clocks. And the only way to reset your body clock is food and light. And as much as we can change the way that you're taking in food and taking in light, we will actually physiologically change your body clock.
Can you talk a little bit more about light? Because that just seems a bit like random.
Yeah,
it does. It seems random.
Again, and out there, I'm so sorry. Yeah.
No, but look, you know, what has light got to do with our well-being and stopping us from binging, you know, at night?
Yeah. So if you think about your body clock, and we see a lot more night binging actually seasonally too. So when we get less light during the day, people's binge eating at night or eating at night tends to go up actually. And so we know in the case of both binge eating disorder and night eating syndrome, we really want to be sure that we are getting somebody out in their community sort of exposed to bright light and not isolating with the curtains down in front of the TV. And the reason for that is that light and food set your body clock. And when you're not exposed to enough light, or if you're exposed to light at the wrong times, for example, watching Netflix in the middle of the night, you know, things like that, you're setting your body clock to run at a time where you don't want to set that body clock to run. You want to be sleeping during the night, and you want dark then, and you want light when you want to be awake. And most people are actually doing the opposite. They're sitting in an office, no windows, you know, no light exposure all day. And then they go home and have every screen, you know, they have their phone, their computer, and the TV on. And so light starts to reset your body clock a bit. And one of the things that we actually use to treat night eating syndrome is what we call phototherapy. And phototherapy is really just, it's easy. It's sitting in front of a light box. And it's a very specific light box. It's very bright light, but it just retrains that body clock a little bit, and very, very helpful for people, and very helpful for people fairly quickly. And often we can get insurance actually. So for people out there in their communities, we can get insurance to actually pay for a light box because it is such an important treatment. And so effective. So it is something, phototherapy, the research is pretty consistent, that particularly in really treatment resistant cases, we can use this and it can have a significant impact on nighttime binging.
You know, what's so beautiful about this, Julie, is that I can see these comments, and some people are saying, oh my God, that's me. I have that.
Yeah.
And it's so amazing to have people realize that they're not alone. Because
Absolutely. And just even within and again, I geek out about this because I think this is so common. So if you think about, you know, the prevalence rates for anorexia nervosa, for instance, they're fairly low, about 0.5 to 0.7% of the general population. Night eating syndrome, we know, is almost 2% of the population. So there are a ton of people out there who meet criteria for both night eating syndrome. And then, of course, binge eating disorder as well, which is, you know, the most prevalent eating disorder, and about twice the prevalence rates of anorexia nervosa. I'm really out now.
I love it. No, it's okay. But everybody, whoever's just joined us, please know my name is Robyn Cruze, and this is Dr. Julie Friedman, and we're talking about night eating. So here's the thing: people don't always know that they have binge eating disorder or they have night eating syndrome.
In fact, Robyn, most people don't. Most people don't know, and it's very rare that we have people come in and say, I have binge eating or night eating. Most of the time they tell me they're an emotional overeater, addicted to food. I mean, they have a lot of names for it, but they don't have the language to talk about it as binge eating disorder or night eating.
So how do they know? Like, what is the criteria for, say, binge eating disorder first? Criteria. How would somebody know if somebody's listening right now and they're like, well, I'm not really quite sure, do I have it or don't I have it? Can I get treatment for this thing?
Yes.
How can they tell?
Yes. So let me start with the diagnosis, and then I can talk a little bit about treatment. For binge eating disorder specifically, and I think this will be helpful, particularly because we went over night eating syndrome criteria previously, but for binge eating disorder, you need to have a binge eating episode. So the way that we define a binge would be eating more in a discrete period of time. Let's say about a 2-hour window. Then most people would eat in that same time period and feeling a loss of control while you're eating, like you can't stop yourself from eating, and feeling guilt, shame, distress, embarrassment, eating alone because you're embarrassed by how much you're eating, things like that. Those would all be binge eating episodes. And in order to meet criteria for binge eating disorder, because again, I think that's important, everybody binges occasionally, but we would expect that somebody is binging minimally 1 time a week for 3 months or more in order to meet criteria for binge eating disorder. So again, the threshold is not very high. And if somebody feels like these binges are occurring with some frequency, they should really look into specialized eating disorder treatment, only because at that level, we would consider that the binge eating behavior has gone from normal or normative binge eating occasionally to an intensity and a frequency and a duration that we'd be uncomfortable with, that we need to intervene very quickly and fairly aggressively with. It's one of those behaviors, and I know our community can relate to this. Mm-hmm. Once it starts, it's very difficult to get out of that spiral. Binging begets binging. The more you
it does feel like addiction. I can see why people think that it's a food addiction or feel like it's a food addiction, because it does. It feels like an addiction.
Absolutely.
Like you can't. And trying to stop that is very difficult.
Absolutely. You're 100% right. And it feels very compulsive. I need to do it to get it out of my mind, almost like using substances can feel.
You feel downright powerless.
Exactly.
That's how you feel. So here's 5 questions that you can ask yourself to know whether you have binge eating disorder. I'm just going to read now. Do you feel like you have episodes where you eat more than what people would eat in the same time period?
Yes. Yep.
Do you experience any distress around your eating, including guilt, shame, or regret? Do you often sneak food or eat alone due to embarrassment over what or how you are eating? Do you feel like your eating is out of control? Mm-hmm. Did either of your parents struggle with binge eating or substance use?
Yep.
So anybody, if you are struggling, if you feel like you have binge eating disorder, I sincerely want you to know that you are not alone. Not only is there a community for your support, but there is also treatment. If you would like to know more about treatment, you can call 1-877-711-1878, or you can go to eatingrecovery.com or private message me. Tell me how I can help you. Tell me what you need from us, and we are all in this together. Yep. So Dr. Friedman, is there anything that you want our community to know?
I would say, just going along with what you were just saying, Robyn, it is imperative that if somebody is struggling, they reach out sooner rather than later, because most people's tendency is to wait too long. And so I think a lot of times people will say, well, I'm not going to reach out because I'm not that sick, or it's not that severe. And I will tell you,
the shame and the embarrassment of it, the embarrassment of feeling like we shouldn't have to ask for help. Yes. I want you all to know that the best thing that I ever did was to ask for help.
Yep.
It saved my life.
Yes, absolutely. That shame is so potent, and most people don't even identify it as shame. They identify it more as dismissing their need. I don't need this. I'm not that bad. And I will tell you that most of the time, by the time we get people into treatment, they're really struggling, and we could have helped them a long time ago had they reached out when they were first struggling. And so I would say you don't have to struggle, and you don't have to struggle alone, that there is not only treatment, but really effective treatment for binge eating and for night eating syndrome.
So I just want to quickly reach out to our community here. Jen, you are not alone. There is help. Look at the comments. You'll see where you can go for help. Or feel free to private message me on our community Facebook page. So I'm just looking at everybody's.
Yes, thank you.
Valerie,
reading them.
Rhonda, you are not alone. We are all here for you. So I just want to thank everybody for coming. And Dr. Friedman, thank you so much for myself and our community.
Thanks for putting up with me geeking out, Robyn.
Oh, I love you geeking out. You rock it.
I love it. I love it. Thank you so much.
You're welcome. Thank you, everybody, for coming. Please know that what we can't do alone, we sure can do together. And happy, happy holidays. May we give ourselves the gift of recovery. At some point, now Jenny Schaefer told me that this would happen. I can't end it.
Still live.
Oh, here we are. Here we are. Woo, see you later.